Good evening, everyone. I am just getting things ready for our live, for our guest, Dionne Sinclair, who'll be joining us this evening. All right, she has joined on the, I want to say on the line, but on Instagram, and I'm just gonna bring her in. Thank you, everyone. Okay, I'm trying to add Dionne and it's not letting me. Let's see. Dionne, my dear, can you try and see if you can join the live through your... Oh, there we go. So you should be coming in, joining. Yay!
Yay!
We got it.
Awesome.
Yes, good evening. How are
I
you?
am fine. Thank you. How are you?
I'm well. I'm doing well this evening. Welcome, welcome, everyone. We're seeing people join us. We appreciate you. Um, I know you're a busy woman. We've got until 7:30, so I'm going to just dive into the standard intro, and then we'll get into some discussions, some chats, spill some tea. So yes, welcome everyone. My name is Dr. Onye Nnorom. You can call me Dr. O. And welcome to Healthcaring Differently, where we basically talk about healthcare. I'm, interviewing my friends and colleagues across the country to find out about different ways that they approach healthcare because they are different. And we do these Instagram lives every Tuesday at 7 p.m. Eastern Time. Please do join our newsletter as well, where I'll be providing even more resources on diversity pathways into medicine, nursing, other healthcare fields. So the first newsletter, it's monthly, it'll go out this month. So thank you. Um, oh, I see joining for my daughter. Oh, that's so nice. Mel Haven. Sorry if I messed up, but yes, thank you for joining. Let me though introduce our special guest today, and then I'll look into the comment section. So Dionne Sinclair is an accomplished certified healthcare executive who is currently the Vice President of Clinical Operations and the Chief Nursing Executive at CAMH, which is the Center for Addiction and Mental Health, where I also work. And she is a visionary leader with a passion for transformative change and innovation. Dionne has honed her skills in creating a climate that fosters innovation and develops new approaches to achieve strategic outcomes. She is also a sought after motivational speaker, and she shares her valuable insights and experiences to empower individuals within and beyond the healthcare community.
Yeah.
Dionne, welcome.
Thank you so much for having me. It's a pleasure to be here.
Yes, it's lovely to have you. And so, I was thinking about the other day, like how long we've known each other. I feel like we've known each other for so long,
The pandemic
but it was the
brought us together.
pandemic.
Yep.
Yes,
Yep.
exactly. That brought us together. I was thinking about that the other day. So, I mean, I'm going to ask you what I tend to ask all of my guests because there's a reason why I've invited you because you are healthcaring differently. So, for our audience who may not have seen the video that you provided or may not have seen fire come up, fire, fire, who might not be familiar with you, do you want to say a little bit more about yourself and how you are healthcaring
Okay,
differently?
I will. I usually start off by saying, do not let my youthful good looks fool you. I've been nursing for over 38
Woo!
years. Just saying that. I'm an immigrant child from Jamaica, and I have a phenomenal mother. Her name is Blossom Sinclair. I wouldn't be where I am right now without her guidance and sometimes, push. And yes, I started out as an RPN of all, and
Oh,
RPNs are amazing. I was
Yes.
one. But I'm a
Okay.
lifelong learner. So I kept going back to school, educating myself, and I've always had a goal and a mission to be in leadership so that one, I could be a role model, but two, I could also be somebody other Black nurses particularly could emulate. And
Oh.
now I'm in mental health and addictions. I started out there actually way back in '88. And one of the
Mm-hmm.
things I've noticed, which is everybody looks after physical health, emotional health. No one's looking after financial health. And it is so important because even in mental health care, anxiety, depression, stress is
Right.
caused by financial issues. And I went through public school. Some of y'all must have gone through public school. How
Right
much did
here.
you learn about managing your finances?
Yeah, I learned nothing. I want to acknowledge the big up that I'm
Yes,
seeing in there. I
yes.
saw Jake say, let's go, and then tell these lives says, hello, Dionne and all. But yeah, I think our financial health, unless you learn it at home, which you usually happens if you have like healthy or well-off parents, that doesn't get passed down through a lot of our communities, especially communities that have experienced extreme colonization or slavery or anything like that. That kind of wisdom does not
Yeah,
happen at the dinner table. Sometimes it's misinformation. It's the opposite that
it's
happens.
so
So
true.
so is that information that you provide to nurses, to healthcare workers, or to the whole community?
The whole community. Actually, I have a soft spot for single moms. I'm one of them. But the whole community needs it because we do, especially immigrants, we do what our parents did.
Yeah.
We bank at the same place our parents bank. They said, go to
Mm-hmm.
school, get a job, work hard, put your money in the bank, save it.
Yes.
And how's that working out for us?
Okay.
Just say, but no one
Mm-hmm.
taught us about investing. No
Yes.
one taught us about delayed gratification, paying yourself first. No one taught us about the credit is amazing. You use it
Mm-hmm.
well, it is can work for you, but you misuse it, it works against you. Those are the things that I believe we didn't know, and it can get you in a lot of trouble. Ask me how I
Yeah.
know. So it's
Mm.
it's one of those things where I call it the definition of poverty. And you
Okay.
guys
Tell us
can
more.
chime in if you something resonates. Definition of poverty: you're working 2, 3 jobs. You're
Mm-hmm.
working a lot of overtime. You work Christmas, Thanksgiving, Easter, every holiday because it's time and a half. Your children are raising themselves because you have to get on
Mm-hmm.
to your next shift. And one of the reasons you're doing all that is because you're trying to catch up or trying to pay catch up with your income. And what happens at the end of the year? What does CRA do? They say, oh, Miss Sinclair, because it happened to me,
Mm-hmm.
you've worked your way into a new tax bracket and you owe CRA a lot of money. And so what do? You work another job. You find 3, 4 jobs and you work more overtime. And it is a horrible cycle where you're on that hamster wheel
Yes.
and you're working really hard, but where are you going? You're not
You're not.
getting anywhere.
Yes. I see Condell saying my people. Yes.
It
Yes. Welcome,
has
Condell.
to
But
stop. It has to stop, and people have to
yes.
literally stop because if that's not getting anywhere, what do you need? Well, guess what? Some people they have financial advisors. They have people to help them. And if we were never taught, guess what? You need to go learn financial literacy. And so that's something I do. I provide financial literacy classes. Yes, I do that because I needed
Okay.
it. I didn't have the literacy classes, 2 master's degrees, didn't know how to manage my own money. Learn the hard way. It is never enough. It's never about how much you make. It's always about how much you save and how much you invest and where you invest. Because I had a
Yes.
savings account, didn't grow. I now have a
Yes.
investment account, it grows.
Now, this is something that I think a lot of people don't realize. Like, we live in a capitalist country, and so health and wealth are very much intertwined.
Yep,
And yes, there are barriers that different communities
yep,
face, including Black community, many racialized communities, people with different identities. But the more we know with regard to financial literacy, the more we can be empowered to navigate the system. You need to know the game board you're playing on.
Yeah.
And my understanding is even in fields like medicine, where people have come from lower income communities, you still see people not necessarily building wealth, right? That was even my experience. And many of you have seen even the TV specials or Netflix where it's happened to football players and basketball players. So it's not just about making the money. You
Yes.
have to understand money, and that is linked to
Yeah.
health. So that's a beautiful thing that you're doing,
And
Dionne.
it's one of those things when you think about when you're working 2, 3 jobs or a lot of overtime, how great are those meals that you're preparing at home? It's not happening. How great is your sleep? When's the last time you went for that checkup that you need to go do because you're at a certain age and you're supposed to be getting your annual test? It doesn't happen because you have this other shift to go to. And so our health deteriorates. And then when you're trying to figure out, okay, am I going to go into overdraft? Is this card going to, you do this at the checkout? That's stressful. And guess what happens when you're stressed? Again, you gain weight because stress
Yes.
hormones are
Yes.
there and you're just not functioning properly and you don't even sleep well. It's so unhealthy to be poor or poverty. You're working, you're making a
You're
buck, but
struggling.
you're struggling.
Yes, yes.
And do you want
And
that for your children?
no. And you know what? So I know, Lucienne says, oh my God, hello, Dionne. So you got a hello. But one of the things that I think I want to make sure our audience knows, because a lot of our audience, you're students, right? So you figure you're going to learn it later, but no, you have to learn it now, because a lot of the debt, especially if you're planning to you're spending the university time, the studying time to go into healthcare. Y'all are here because you're either in healthcare or entering. If you don't know these things in advance, it's not enough to simply make the money. But also, even if you want to help your patients, look at what Dionne is doing. She's talking about educating the community,
Yes.
right?
Yeah.
So there's so many levels to this that you have to actually understand it and live it now as a student, bring it into your career, and then spread that knowledge within the community, because yes, health, like wealth is health. And so community needs to know about these things too. Our last guest, Dr. Stephanie Zhao, was also talking about this, right? This is major stuff. But please go ahead, Dionne. I'm just emphasizing. I'm just fangirling.
So here's this, being a doctor, if you do not have blood flow in your body, what happens to you?
You're done.
Okay, so imagine if you don't have cash flow in your
Mm,
life. So it's same thing. Without cash flow, we found that out. A lot of people found that out during COVID. A
yeah,
lot of lockdowns, a lot
yeah,
of people were laid off. And if it wasn't for government assistance, you have no reserve. So the definition of wealth is not what car you drive or what house you live in. It's how long you're going to last if you lost your ability to earn income. And I've been in healthcare, and there's cycles when it comes to healthcare where layoffs may happen. Not right now, because I know we need all the workers we can get. But what would you do? And for some, I know a lot of travel nurses. They left and they are agency and they're making good coin.
good money.
But guess what? There's no disability for you because you left your benefits. So have you planned for that? Did you prepare for that? Have you reached out to somebody for that? It doesn't have to be me, but those are things I tell them you got to look out for. What about your critical illness or life insurance? And yes, Black people, dead serious. You have to take care of that, because if I see another GoFundMe, come on, we can do better. The education is there. You can do better. And again, there's so many people out there willing to help. We just have to say, hey, I need all this protection because it's not for me. It's for my children. It's for my grandchildren. It's for my great grandchildren. I want them to
Yeah.
remember me and my name, how I changed the future of the family, leaving a legacy for them that they're
Yes.
saying, hey, we don't have to suffer. We don't have to live paycheck to paycheck. We don't have to work 2, 3 jobs or overtime unless you want to. But
Unless you want to. And I think that's a thing. So there's so many layers to this, because yes, in our families and for our parents and grandparents, we need to have those conversations
yeah.
about insurance and having a will and having power of attorney. All of these things are really important. And again, for those of you who are thinking about, a life in healthcare, you're going to play that role within your families, right? So you still want to know about these things.
Yeah.
But I think another thing that, again, like we're talking for nurses, it's that overtime, like you described. Physicians don't generally get a pension. Like recently, the Ontario Medical Association, I think, started working on this, or MD Management, one of them, right? But
Yeah.
historically, a lot of you will see really, really senior doctors working, and
Yes.
you're wondering why this person is still working. Now, for some, it can
Choice.
be
Yeah.
because of the love of medicine, but for some people, it's because they didn't have a pension and they didn't save enough for their retirement. So
Yeah.
this applies to people in healthcare too. Like this piece around, it's not just how much money you make, but can continue your level of living
Mm-hmm.
even when you're not out there working shifts. Now I mentioned
Yeah.
doctors, so now I want to ask you about another question, because I part of why I brought you on is because I think it's amazing, and I want people to see you as a nurse leader. You are a VP, you are an executive, you are a boss to doctors, you are the boss woman. And I'm curious, and I want them to hear, what is your experience as a Black woman leader in healthcare, right? What is that like?
Well, I have to say, I think it might be my personality and my disarming people, because I am a lot. I come on strong. However, I come on with a smile. And I've learned that in healthcare and anywhere, it's about relationships, building relationships. So if anybody, like you go talk to them at CAMH, they all know I have 3 kids. They
Mm-hmm.
know right now I'm going to be a grandma. I'm just waiting on that, my first grandbaby to drop. They know more about me intimately. It's not beyond the nurse and she went to school.
Right.
No, they know I'm Jamaican and I love my jerk chicken. It's
Hey.
those kind of things. And so, um, just being a leader, I am visible. I walk the units, and oh gosh, the nurses, they know me because when I first started, I showed up on weekends. It's like, what are you doing here? And it's like, well, I'm allowed to come and meet the staff. Nobody comes around. It's like, well, I come around. I've been at where you are.
Right.
And it's great because that's where a lot of the ideas are. The best ideas are sitting at the bedside. And so I talk to staff, and I like being a role model for other Black nurses who want to be in leadership. I always
Right.
say, even though I started as an RPN, I didn't stay there because that was my goal, to be in leadership. But
Mm-hmm.
no matter where you start, you can always achieve your dreams. You just have to work for it, be very consistent, and be that lifelong learner, because it will not be handed to you. It
No,
won't. You're going
that's
to
true.
work, and you have to build relationships. The other reason you have to build relationships is somebody will call your name in rooms where opportunities being discussed when they know what your goals and dreams are. So I always talk to people I coach and mentor. It's like, okay, what would you like to do? What are some of your goals? Anya, you
Yeah.
know I'm going to be a CEO. I'm not yet, but I'm planning to be a CEO. So guess what
You
you
know
can
what?
do?
No, go ahead. Go
Yeah,
ahead.
when you
Finish what
know
you're saying.
the CEO position, you're sitting around
Yes.
at UFT or UHN somewhere,
Yes.
and they say, "Oh, we need an interim CEO for XYZ hospital." You can say, "Yo, I know this nurse named Dionne Sinclair. She won't shut up about it. She wants to be a CEO. It's her job, and maybe you should give her a call, see if she meets the criteria."
I love that, because that goes against what some of us learn in our cultures, where we've had a history of intergenerational violence, and so what's taught down is like, keep your cards close to your chest. Don't tell anybody what your dreams are, because they're gonna, you know what I mean? And so I love that you're saying this, that we have to trust in people. So you select the people that you want. You select the kind of mentors, the type of champions, people who look like you and do not look like you, who
Yep.
can help you advance your career, and you let them know what your dreams are. And the other thing is, you do have to develop a little bit of a thick skin, because I've been in rooms where I said, you know what, it was like 10 years ago, where I said, I want to work in issues of health equity with regards to racism. And I remember being told by some of the CEOs, like, what is that? That is not a thing, right? And going home and crying. But that's okay. I cried. The next day I got up and I committed. And then now I'm getting more of those opportunities, because now, 10 years later,
Yep.
it's resonating. So
E-
you also have to, it's a risk, but it
Yep.
is worth it.
Absolutely. Absolutely. And you know what? You can be that same person for someone else. And so when
Yes,
people say, well, I didn't get that job, it's like, did anybody know that you wanted it?
that's
And it's like,
it.
well, I didn't tell anyone. It's like you have to share, especially when somebody has that experience. What I founded the Canadian Black Nurses
Yes.
Network. We're on Facebook, we're on LinkedIn, but what we do interview prep. Somebody's going for a manager, director job, we will sit them down and say, okay, here's what to do, here's what not to do. We'll check over somebody's resume and saying, okay, you need to update this. You cannot put that you were, Rubik's Cube
Hmm.
champion in grade 7. That needs to come out. I made that up.
Right,
But
right,
just help them format their resume and prepare for the interview, because I know what I expect when I'm interviewing directors.
right,
So you're always going to get a question that's like, tell us why you're the best person for this position. You need that story, but it has to be an elevator pitch. It can't go on for a half an hour. Those
right.
kind of things we share, and it's been great coaching. And I ask anyone I coach, what's your story, what's the Dionne plan?
Right,
And I
right.
got my plan written down, and I've been following it. It's been long, but it's working.
Yes, no, that's it. You have to be able to, again, tell people your dreams so that they can help you achieve it. And some people will uplift you. Some people, yes, might pull you down, but you can't just keep it to yourself. People won't know. Now, speaking of keeping it to yourself, it's 7:20. I'm going to give like a warning because we end at 7:30. If y'all have questions, please let me know. I'm seeing the comments. I know
I haven't
Melvahin
seen
is saying we
Mel.
don't
Oh
do
my
that
God. Hi,
enough.
Melva.
Okay, so we know Melva's here, and yes, we keep everything to ourselves, but we have to be able to, address that both around our dreams and our mental health. Right? There's so many ways where keeping things inside is not does not help us to move forward. But if folks have questions, please do, because we've got again like a Black woman boss, a Black nursing boss, a leader, somebody who's doing transformational work around wealth and health. So yes,
And
please
it's
ask your
have
questions.
something outside of your Monday to Friday day job. I love fitness. I will exercise. If anybody Googles Dionne Sinclair, you'll see a lot
Right?
more than my professional photos. I'm just saying, but it's good to have a well-rounded. You can't just be
Yes.
stuck on one thing. And when you go back to the finances, the Canadian tax code favors business owners. So be an
Mm,
entrepreneur. What are
yes.
you passionate about? Like right now, you're doing what you're passionate about. I'm passionate about EDI, so I do something like that. I'm passionate about educating people and making sure they become financially literate.
Yes.
Find something you're passionate about, and it's not work. It is
Yes.
absolutely not work, because it's what you love to do. But we have to think, okay, what do I want my future to look like?
Hmm.
And I dream. I wanted a house in Jamaica. I'm going to travel. I have to see the world. It's so big and so nice. I got to go to South Africa. But guess what? You need money to get there.
You do.
And you need
You
to
do.
save it. You cannot charge it. So you have to plan for these things. And if you don't have the discipline yourself, find somebody that will help you. There's
To coach you, help you. Now we do have a question and we have a comment. So Melva says she's here for Ava, who's in study hall. Shout out to Ava, who's doing that study, and Ava, there will be the recording after. So most people do actually watch the recording after. So no worries, but we love you, Melva, for tuning in. We have a question though. So the question is, how do you overcome imposter syndrome? Right? Like I said, you're a Black woman, a nursing leader, so I work at CAMH. I'm a doctor at CAMH, but you outrank pretty much everybody in the building except maybe like, I don't know, 5 people. I don't know what the number is, but you basically outrank everybody in the building. How do you overcome imposter syndrome?
So there's a book, it's called I'm Not Yelling. And inside the book, there's an author that talked about imposter syndrome.
I
And
had her
there's
on my
no
podcast.
such
Sorry, I'm so
thing.
excited. But
There's
sorry, go
no
ahead, go
such
ahead.
thing. Because guess what? Think about it. Imposter treatment is what happens to you. So you show up, you are qualified, but they'll treat you like you're not qualified. They'll treat you like you're not experienced. Check how you're being treated. You are qualified. Maybe you lack the experience, but everybody has to start somewhere. They'll treat you like, oh, you're just here because. And it's like, it's the treatment you're getting. And those people are projecting their insecurities onto you.
I love
because
it.
they're the ones not qualified. So do not accept that imposter syndrome. You're not an imposter. You are brilliant. You are qualified. You're exceptional, and you're the right person at the right time for that job. And anybody who treats you like you're not qualified, say, listen, wait a minute, hold it. Like, introduce yourself, tell them who
Yes,
you are, but tell them you're not going to accept their projection onto you. They get to keep that. So I never ever think about, oh, I'm an imposter, I don't belong here. Oh, I belong here, I belong in that
girl.
space, I take up space, and I check how I'm being treated.
Yes,
Imposter treatment is what happens, and don't let people treat you that way. Don't accept it. And plus, I'm Jamaican. We're like, very
hey,
proud people. Again,
right?
there's many proud
Big
people,
up
but
Jamaica.
we're exceptionally proud, and so we'll
Yes.
call you out on. Oh, no, no,
No,
you're wrong about that.
I love what you said. First of all, shout out to Elizabeth Liba. That's the author of that book because I had her on my podcast. Check out Race, Health, and Happiness. So Liz brought, the fire. So I met her. She's from the United States. So I Am Not Yelling. Fantastic book. I love what you said about like you have to think about who you are. Honestly, we sit at tables where people make us feel like we don't deserve to be there. And it's like if they put on this skin, this gender, had to go through what we went through, would they be at the table? That's the question.
Yeah,
I'm like, are you supposed to be here? Because I know what I've been through. I'm supposed to be here. But pardon me,
yeah.
were you, right? Based on your privilege and your path, that's the question. I'm not to be questioned.
Oh,
But it takes a while to have that. If you don't have that right away, that's okay. Let um your gifts and your mission be louder than any imposter voice in your head. Let that be louder because you're here for a reason. You have the gifts and just lean into that.
what's the name of your podcast?
Oh, the podcast is Race, Health, and Happiness, and it's available on all podcast platforms. It's
Yeah.
about staying well in a racialized world.
So
Thank you. Okay, it's
I
7:26. Wait, questions, y'all. Ask the questions. Dionne, go ahead, but I'm
no,
just telling
I
people,
was going to
put in your
say
questions.
I'm I'm going to be doing a podcast about people that look like me.
Okay.
However, it's called the Underestimated Podcast. It won't be the
Ooh.
Black healthcare person podcast. It won't be the equity deserving podcast. It will not be BIPOC. We're just underestimated. But look at us now. And so
Mm-hmm.
I'm plugging that just to say that's the
I
new
love it.
word. Oh gosh, I have to. It's not my word. It's not my word. Oh, he's the business reporter on CBC, and I should. Mark Harrison.
Ah,
Mark Harrison mentioned it a couple weeks ago. The underestimated. Think about it. It's not that what is it? Racialized community over there. It's the underestimated people in that neighborhood, and the
I love it.
underestimated kids in that class.
Right?
We're
Oh my goodness.
underestimated, and so we have a story to tell because look at us now. Look at you now. I bet you coming to this country, you're underestimated, but guess what? We have a story to tell. That's all.
Yes. And everybody needs it. That's why we have health caring differently, is to hear these stories, to understand how all of us, we bring our different perspectives to be able to do work in a different way that has impact. So what I like to say is some people struggle to think outside the box. We were born outside the box. We come from communities that strived and thrived because they do so outside the box. And
Mhm.
what's beautiful is we can dance in and out of the box.
There you go.
We're in
There
it
you
and
go.
we're out of it,
There
and
you
we
go.
bring all of that energy and ingenuity and innovation that you talk about. Yeah. So we've got 2 minutes left. I'm leaving space if anybody has any more burning questions. But I think for me, I want people to know how they can be in touch with you, how they can learn more about the different things that you're doing. Deanne, you're both dancing. Thank you, ladies. Oh,
Yeah.
thank you. But
Hey, Lucy. Oh,
yes.
wow. I'm on LinkedIn. I'm on Facebook, Dionne Sinclair. I'm on Instagram, Dionne Sinclair. There's no funny name. And anyone can reach me. It's Sinclair Dionne, the number 2 at Gmail. If you want to reach out, gmail.com. So, or
All
just
right.
message me on LinkedIn, message me on IG. I look at those messages as well. It is so, I saw so many familiar, like Condell. I used to live in Thunder Bay. I miss the North so much. So there's a Thunder Bay crew. Ezekiel's on here. There's a whole
Aw, I
crew from Thunder Bay. Do you have any ideas where to
think that
get?
one's internship for pre-med students. So I think that one's for me. But shout out to Thunder Bay because I also used to work up in a small town just north of Thunder Bay called Long
Yeah,
Lac, like Long Lac.
I know
So
that.
I would fly into Thunder Bay. Anyways, so very kind people there. So big up and shout out and much
I
love.
was,
Um, hmm? Oh,
I
Ottawa.
was,
Ottawa wants a
yeah,
shout out.
Ottawa's
Okay.
in the house. I lived in Ottawa for 18 years. In Thunder Bay, I was director of home and community care in Northwest Lynn. I looked after from Manitowoc all the way to Kenora, the
Oh,
largest
wow.
geography in the province. And it's like, took me to, you know,
Did it.
looked
Did
after
it. Oh
the
my goodness.
largest, but I loved it. I love
Um,
the North.
So for internships in Canada, we there's no such thing as internships if you're a pre-med student. There's just residency for people after they've completed medical school. But please, like I said, so you can go on our website, healthcaringdifferently.com. The newsletter, our first newsletter is going to come out this month, and it will provide information about different communities of support and different diversity programs where you can get opportunities to volunteer in hospitals, to have research opportunities. Dionne, I am sensing as a sister that you have something to add to it, so I will give
Because
you the
that's
microphone.
pre-med student. At CAMH, we have a job for program assistant. You've got a healthcare background, you're interested, and it's a paid job.
Hey.
So it's not an internship. You're not interning as a doctor, but you get to be in a hospital, in the environment, working with patients, working with other doctors, working with nurses, allied health staff. And that is something, if it's money that you want while you're in between classes, that is something to consider. And other hospitals have those type of positions as well. PSW you need a certification for, but program assistant, look it up, CAMH under careers.
Oh, we're going to talk offline because I want to see if I can include that in the newsletter, girl. Because I think that that's something we need to have in the newsletter.
Yeah,
So we're going to talk about that because that's a pro tip. That's a
yeah,
hack, right? To be able to get in there and have that exposure and experience because that's what it's about.
that's
So we
it.
want you to have that. Like I said, I'm bringing my friends to the dinner table for all of you, bringing them to the Instagram table so that you can have this. And the posting will be available after. You can share it with friends, share it with folks who are joining who are parents. You can share it with your kids and nieces and nephews. So Ali says, thank you. Amazing talk today. Thank y'all
Thank
for tuning
you.
in.
Thank you
Thank
so
you,
much.
Dionne.
Thank you. This worked
All
out.
right. Yes, it worked out lovely. So, all right. Have a lovely evening, everyone. Thank you. Take care. Bye.